we will cover pulmonary hypertension. The heart pumps blood to the lungs to add oxygen to the blood. The blood goes back to the heart. From there, it travels to the rest of the body to supply oxygen. The blood moves from the heart to the lungs through blood vessels called pulmonary arteries. If the pulmonary arteries become damaged, narrowed, or blocked, the blood does not flow through them. This can increase the blood pressure in the arteries and cause pulmonary hypertension. Pulmonary hypertension is a type of high blood pressure that affects the arteries in the lungs and the right side of the heart. These are the blood vessels that carry oxygen-poor blood from the heart to the lungs. It develops when the blood pressure in the lungs is higher than normal. It is a serious condition that can damage the right side of the heart. The walls of the pulmonary arteries become thick and stiff and cannot expand as well to allow blood through. The reduced blood flow makes it harder for the right side of the heart to pump blood through the arteries. If the right side of the heart has to continually work harder, it can gradually become weaker. This can lead to heart failure. Pulmonary hypertension is a rare condition that can affect people of all ages, but it's more common in people who have another heart or lung condition. In one form of pulmonary hypertension called pulmonary arterial hypertension, blood vessels in the lungs are narrowed, blocked, or destroyed. The damage slows blood flow through the lungs. Blood pressure in the lung arteries goes up. The heart must work harder to pump blood through the lungs. The extra effort eventually causes the heart muscles to become weak and faint. In some people, pulmonary hypertension slowly gets worse and can be life-threatening. There is no cure for pulmonary hypertension, but treatments are available to help feel better, live longer, and improve the quality of life. Pulmonary hypertension has many different causes. It is usually a complication of heart disease or lung disease, but many other diseases and environmental factors can raise the risk for pulmonary hypertension. Pulmonary hypertension is dangerous because it disrupts the flow of blood through the heart and the lungs. High blood pressure in the pulmonary arteries causes these arteries to become narrow. As a result, the heart must work harder to pump oxygen-poor blood to the lungs. Over time, pulmonary hypertension damages the heart and causes problems throughout the body. It can be fatal without treatment. Pulmonary hypertension can develop on its own or be caused by another condition. Sometimes the cause is unknown or is not clear. The changes in the pulmonary arteries that lead to pulmonary hypertension can be caused by various conditions that cause problems with the smaller branches of the pulmonary arteries. Conditions that affect the left side of the heart, including left-sided heart failure and congenital heart diseases, lung diseases or shortage of oxygen in the body, that is hypoxia. Lung diseases such as COPD, chronic obstructive pulmonary disease, interstitial lung disease, emphysema, sleep apnea, pulmonary embolism, that is blood clots that cause narrowing or a blockage in the pulmonary arteries. Other medical conditions such as liver diseases, sickle cell diseases, connective tissue disorders like scleroderma. Different types of pulmonary hypertension. Pulmonary hypertension is classified by the WHO according to its causes or associated underlying conditions. Causes of pulmonary hypertension is depend on the type of pulmonary hypertension the patient has. They include a range of disease and underlying condition as well as environmental exposure, that is toxins and drugs. The first type is Group 1 pulmonary hypertension due to pulmonary arterial hypertension. Pulmonary arterial hypertension makes the pulmonary arteries become narrow, thick or stiff. Only a little amount of blood can flow, which raises the pressure in the pulmonary arteries. Pulmonary arterial hypertension refers to increased pressure in the vessels caused by obstruction in the small arteries in the lung for a variety of reasons. The causes of pulmonary arterial hypertension include congenital heart disease, diet pills like fen-phen, it is an anti-obesity drug, genetic mutations, glycogen storage disease. Glycogen storage disease is a rare metabolic disorder where the body is not able to properly store or break down glycogen, a form of sugar or glucose. Human immunodeficiency virus, liver disease, lupus. Lupus is a long-term autoimmune disease in which the immune system attacks healthy tissues. Portal hypertension. Portal hypertension is high blood pressure in the portal vein that runs through the liver. It's usually caused by liver disease and cirrhosis. Pulmonary capillary hemangiomatosis. It is a disease affecting the blood vessels of the lungs where abnormal capillary proliferation and venous fibrous intimal thickening result in progressive increase in vascular resistance. Pulmonary veno-occlusive disease. It blocks small veins in the lungs. The blockage leads to high blood pressure in the arteries of the lungs, which in turn leads to heart failure. Scleroderma. Scleroderma is an autoimmune disease that causes inflammation and fibrosis in the skin and other areas of the body. Some recreational drugs like methamphetamine. Some people develop pulmonary arterial hypertension without any clear cause. These cases are known as idiopathic. The second group is group 2 pulmonary hypertension due to left-sided heart disease. This is when long-term heart disease results in damage to the pulmonary arteries, eventually causing pulmonary hypertension. The left side of the heart pumps out blood to the entire body. If there is a problem on this side of the heart, it affects the right side of the heart and the entire pulmonary circuit. Blood backs up in the heart, raising the pressure in the pulmonary arteries. Heart problems are a common cause of pulmonary hypertension because the left and right side of the heart work together. A problem with the left side also affects the right side. The right side of the heart is responsible for pumping blood into the pulmonary arteries. So, left side heart problems cause a chain reaction that affects the rest of the heart, the pulmonary arteries, and the lungs. Left side heart problems that can cause pulmonary hypertension include aortic valve disease. The aortic valve connects the left ventricle to the aorta. The aorta is the largest blood vessel in the body, and it is responsible for sending oxygen-rich blood out to the rest of the body. With aortic valve disease, the valve may be leaky or narrow. Other problems like congenital heart disease and endocarditis can also affect the aortic valve. Next problem is left-sided heart failure. This means the left side of the heart can't pump blood as it should. Next problem is left ventricular hypertrophy. This is a thickening of the muscular walls of the left ventricle that makes the heart less efficient at pumping blood. It is usually caused by long-term hypertension and other heart problems like arrhythmias. Next cause is mitral valve disease. Through mitral valve, the blood flows from the left atrium to the left ventricle. It may become too stretchy, leading to regurgitation. It may also become too narrow. Over time, mitral valve disease strains and damages the heart. The third type is group 3 pulmonary hypertension due to lung disease or hypoxia. Certain lung problems cause the arteries in the lungs to tighten. Less blood flow through the lungs raise the pressure in the pulmonary arteries. Lung problems are another common cause of pulmonary hypertension. Some people with left-sided heart disease also have lung disease or lack of oxygen, that is hypoxia. Lung issues that can cause pulmonary hypertension include chronic obstructive pulmonary disease, interstitial lung disease. That means client has fibrosis or scarring in the lung tissues. The scarring leads to breathing problems and coughing. Obstructive sleep apnea. This condition causes the airway to become partially or completely blocked over and over again as the person sleeps. As a result, less oxygen reaches the organs. Lung developmental abnormalities and chronic high-altitude exposure. Long-term exposure to high altitude in people who may be at risk of developing pulmonary hypertension. Next type is group 4 pulmonary hypertension due to blockages in the lungs. Blood clots or scars prevent the blood from flowing normally through the lungs. This puts more stress on the right side of the heart and raises pulmonary blood pressure. A pulmonary embolism is a blood clot that travels from somewhere else in the body and gets stuck in the blood vessel in the lungs. These blood clots are often treatable, but they may leave behind scar tissue. In some patients, pulmonary embolism or blood clots in the lungs arteries can form scar-like tissue, blocking or narrowing the arteries and leading to CTEPH, chronic thromboembolic pulmonary hypertension. This is a condition that involves blood clots and scarring in the arteries in the lungs. These scars can make it harder for blood to flow through the pulmonary arteries. As a result, the blood pressure in the pulmonary arteries goes up. Some CTEPH can be cured with pulmonary thromboendarterectomy. Next type is group 5 pulmonary hypertension due to other disorders. This group includes any other cause that doesn't fit under another heading. The exact mechanism for how the condition triggers pulmonary hypertension aren't always clear, but there is an association between these conditions and pulmonary hypertension. That means people with these conditions may face a higher risk of developing pulmonary hypertension. Pulmonary hypertension occurs along with other conditions. Such conditions include kidney disease, problems with the function of the kidneys, Langerhans cell histiocytosis, a disorder that causes scarring and cysts in the lungs, sarcoidosis, an inflammatory disease that usually affects the lung and lymph nodes, thyroid disease, disorders that affect the thyroid production of hormones, tumors, cancerous or benign tumors may put pressure on blood vessels in the lungs, blood disorders including polycythemia vera and essential thrombocythemia, metabolic disorders including glycogen storage disease, Gaucher disease, a metabolic disorder that affects the organs and bones. Eisenmenger syndrome is a type of congenital heart disease that causes pulmonary hypertension. It can occur with unrepaired holes between the heart chambers. An example is a large hole in the heart between the two lower heart chambers called ventricular septal defect. The hole in the heart causes blood to flow incorrectly in the heart. Oxygen-rich blood mixes with oxygen-poor blood. The blood then returns to the lungs instead of going to the rest of the body. This increases the blood flow and pressure in the pulmonary arteries, causing pulmonary hypertension. Certain factors can make clients more likely to develop pulmonary hypertension, such as age. The condition is usually diagnosed between ages 30 and 60. Growing older can increase the risk of developing group 1 pulmonary hypertension called pulmonary arterial hypertension. The environment, being exposed to asbestos or having certain infections caused by parasites can raise the risk. The family history and genetics. Certain genetic disorders such as Down syndrome, congenital heart disease, and Gaucher disease can raise the risk of pulmonary hypertension. Blood clotting disorders or a family history of blood clots in the lungs also increase the risk of pulmonary hypertension. The lifestyle habits. Smoking and illegal drugs such as cocaine or methamphetamine can raise the risk of developing pulmonary hypertension. Certain medicines, for example, the drugs which used to treat cancer and depression, and some weight loss medicines such as fen, can make more likely to develop pulmonary hypertension. Pulmonary hypertension is more common in women than in men. Being overweight, living at a high altitude, smoking and using tobacco products, these factors increase the risk of developing pulmonary hypertension. Certain medical conditions also raise the risk. These include blood clots in the pulmonary arteries, connective tissue disease, Down syndrome, Gaucher disease, heart disease, a congenital heart defect, HIV, liver disease, and lung disease. Now we will see the pathophysiology of pulmonary hypertension. Pulmonary hypertension is characterized by the chronic elevation of pulmonary arterial pressure and pulmonary vascular resistance, leading to right ventricular enlargement and hypertrophy. Pulmonary hypertension may result from respiratory and cardiac diseases, the most severe forms occurring in thromboembolic and primary pulmonary hypertension. Pulmonary hypertension is most often defined as an elevated mean pulmonary arterial pressure greater than 25 mmHg at rest or greater than 30 mmHg during exercise, the pressure being measured by right heart catheterization. The elevation in pulmonary artery pressure results from an elevation in the pulmonary vascular resistance caused by a multifactorial pathogenesis involving genetic and environmental factors. Factors that might affect the ability of the right ventricle to adapt to an increased pulmonary vascular resistance are age of the patient at onset, rapidity of onset of pulmonary hypertension, coexisting hypoxemia. Pulmonary hypertension has several pathophysiologic mechanisms depending on the underlying etiology. Nevertheless, the following sequence of events is almost always present. Pulmonary arterial hypertension results from three main elements: vasoconstriction, that is occurring early in the disease; thrombosis, which is occurring during the evolution of the disease. Thrombosis is the formation of a blood clot within arterial or venous blood vessels, limiting the natural flow of blood. Then remodeling takes place and becomes the most important factor. Pulmonary vascular remodeling is an important pathological feature of pulmonary hypertension, leading to increased pulmonary vascular resistance and reduced compliance. It involves thickening of all three layers of the blood vessel wall due to hypertrophy and/or hyperplasia of the predominant cell type within each layer, as well as extracellular matrix deposition. An initiating factor leads to increased resistance in the pulmonary vasculature, causing narrowing of the vessels and impaired blood flow. As a consequence, the right ventricle adapts by increasing right ventricular systolic pressure to preserve the cardiac output from the right heart. Over time, increasing right ventricular systolic pressures will subsequently result in chronic changes in the pulmonary circulation, oxygen-poor blood returning to the heart from all body organs, and tissues travel from the right side of the heart through the pulmonary arteries into the lung. Within the lungs, these arteries divide into smaller vessels in order to take in oxygen and get rid of carbon dioxide. The oxygen-rich blood then returns to the left side of the heart, from where it is pumped back to all body organs and tissues. Normally, the blood flows relatively easily through these vessels in the lungs. But in pulmonary hypertension, the affected blood vessels progressively become stiffer, thicker, damaged, and narrow. This makes blood flow much more difficult and causes the blood pressure in the lungs to rise and the right side of the heart to work harder and impairing blood flow. Over time, this added stress to the right side of the heart can lead to other medical problems. In addition, the increased workload of the heart causes thickening and enlargement of the right ventricle, making the heart less able to pump blood through the lungs, causing right heart failure. Stages of pulmonary hypertension. There are 4 main stages of pulmonary hypertension. The World Health Organization calls these functional classes. They are based on the symptoms a person feels and refer to how well a person can carry out the daily activities. As pulmonary hypertension gets worse, the symptoms become more noticeable and more disruptive to the daily life. Once a diagnosis of pulmonary hypertension is confirmed, the condition is classified according to how the symptoms affect client and the ability to do everyday tasks. Pulmonary hypertension is divided into 4 functional classes. Class 1. Pulmonary hypertension is diagnosed, but there are no symptoms during rest or exercise. Class 2. There are no symptoms at rest. Everyday chores and activities such as going to work or going to grocery store may cause some shortness of breath or mild chest pain. There is a slight limitation of physical activity. Class 3 is comfortable at rest, but doing simple tasks like bathing, dressing, or preparing meals causes fatigue, shortness of breath, and chest pain. The ability to do physical activity becomes very limited. Class 4. Symptoms occur at rest and during physical activity. Any type of activity causes increased discomfort. The healthcare team may use a risk calculator that considers the symptoms and tests results to understand what type of treatment is needed. This is called pulmonary hypertension risk stratification. Symptoms of pulmonary hypertension. Diagnosing pulmonary hypertension can be difficult because many of the signs and symptoms are similar to other lung diseases like asthma and COPD. At the start of pulmonary hypertension, client may not have any symptoms. When client do start to notice symptoms, mild symptoms may be present. But pulmonary hypertension symptoms get worse over time, making it harder to do the physical activities. The first symptom of pulmonary hypertension is shortness of breath during the daily activities. These may include climbing stairs or grocery shopping. Client may also feel short of breath when doing exercise. As pulmonary hypertension progresses, client feels shortness of breath even when client is not moving around. Other symptoms include bluish color on the skin or lips, chest pain or pressure, dizziness or fainting, fatigue, feeling less hungry than usual, pain in the upper right side of the tummy, heart palpitations, the feeling that the heart is pounding or beating too fast, swelling or edema in the ankles, legs, or tummy. Pulmonary hypertension symptoms make it hard for client to exercise or carry out the normal daily activities. The symptoms of pulmonary hypertension are sometimes hard to recognize and are similar to the symptoms of other medical conditions. So sometimes it can take years for someone to get diagnosed with pulmonary hypertension. If client has a type of pulmonary hypertension known as pulmonary artery hypertension, Client may not have any symptoms until the condition is quite advanced.